And here we go. Welcome everybody to The Big Idea. Dr. Jeffrey Hanna. Today we're going to be talking about concussion, and my emphasis in this video is going to be particularly addressing young athletes, because it's not just a head injury. There are knock-on effects from a head injury that can set us up for future head injury, dizziness, headache, migraine, neck problems much later in life. And I'm going to do this video backward from the way that I normally do. I'm actually going to end with a take-home message so that you can be done watching this in about 2 minutes. But then we're going to do a deep dive into a recent article that really goes through a lot of the fine-tuned details that are really important for anybody to know, whether you are a young athlete or you have a son or a daughter who is a young athlete. Let's have a look. Okay, we are going to start with the end in mind. So the take-home message, number one, is that a head injury is a neck injury. You cannot have a head impact without there also being a whiplash effect that can ultimately damage the neck. And those types of problems oftentimes go underdiagnosed. And when that happens, that can set us up for recurring head and neck injuries and also potential relapse down the track. So that's number one. Number two, and this is super important, when it comes to signals that go from the body up to the brain, yes, you have pain signals, but you also have what are called proprioception and mechanoreception. These are going to come from the muscles and from the joints of the neck that let your brain know where your body is in open space. And if it is ever sending abnormal signals, this is what's known as a joint position error. Joint position error can persist for 3 years following a concussion. And this will fill into number three, is that these types of findings of an injury, they can actually persist much longer even after the symptoms have resolved. So oftentimes people think, okay, yep, I'm feeling all good. Everything is ready. We're ready to go back onto the field or wherever we're playing it, if it's in the arena. The problem is if some of these neurological these neurological signs persist, that can actually set us up for future injury, even if we are not having any symptoms whatsoever. So very important that we are assessing not just pain, but function of the neck because of how it affects the brain. And then number four is that we should be having not just after an injury, post-assessments, but ideally pre-assessments before the season actually begins to establish a baseline. Number one, are the messages being sent up to the brain the right way? And is the neck and are the joints of the neck moving the right way in the beginning? That way, if there is an injury, we've got an established baseline, and that is far more important than just the resolution of symptoms to know that the function of the system as a whole is working again the way that it should be. So we're going to do a deeper dive now, but that's the take-home message here. If you did enjoy this one already, please share the like, subscribe button with other people who you think would benefit from this information. But what we're going to do next is we're going to dive a little bit deeper. So this might be for people who want a little bit more of the deeper dive, or for practitioners in this field so that you can check out some of the new research on this topic. Let's have a look. Okay, here's what I've got for you. So cervical spine and vestibulo-ocular screening in elite female athletes with a history of concussion. This was done down at Griffith University in Australia on the Gold Coast, so actually just a little bit south of where I had used to practice. And they were looking at both amateur but also semi-pro female athletes because they knew that women actually have a slightly higher incidence or more susceptible to concussion injuries, mostly because of genetics. The ligaments are a little bit more lax, muscles not quite as strong, so more susceptible to these types of things. And we'll dive into this a little bit deeper here, but I'll kind of jump you through here a little bit in terms of what the results were again. So first, kind of finishing with the end here. A history of headaches finding on manual examination, so feeling Are the joints of the neck moving the right way, yes or no? And symptom provocation on what's called vestibulo-ocular motor screening. I'll jump to that a little bit. Short of it is how well are you able to actually maintain gaze stability when you're moving your head different directions trying to follow them. These were significantly different between groups for those with and without a history of concussion. Point being is that you can look at these different kinds of tests to find out, has there been a concussion in the past, but also to establish baseline so that when you are getting back into the return of sport, you don't actually have subclinical findings that can set you up for a future injury. So the results of this study suggest that athletes with a history of concussion should undergo manual assessment of the cervical spine and the vestibulo-ocular system, regardless of baseline self-reported symptom profile. As I said, even if you are feeling normal and you're ready to go back into sports, you want to actually check these things to make sure that things are working right between the neck and the brain in the first place. Now, what I'm going to do is I'm going to kind of scroll down in this particular article so that you know where I got some of the additional citations right here, and also so that you know what the research was that they are doing here. So you can read the whole thing. It's written, some research, really, really technical. This one is in good English, so we really like it. So they're talking just first and foremost on the prevalence of concussion, that it's most common, at least in the US, for people who are playing gridiron, so that is football. For women, it's soccer because of slide tackles, headbutting the ball. So what they had said, firstly, ideally, as suggested by the current guidelines, so 2023, preseason or baseline measures should be compared with post-concussion measures in sport to allow improved concussion recognition to inform treatment and decision-making around return to sport. What this means is it would actually be a really good idea when young athletes are first going back into sports and they need to have that physical done, that the assessment is actually establishing baseline, and we'll talk about this in a sec, of how their brain, how their eyes, and how their inner ear is able to function, but also are the joints of the neck moving, as I've said, the right way. Because once an injury happens, you ideally want to have a baseline to know this is what it actually looked like before the injury happened in the first place. So let's scroll down here a little bit, because this is where, again, just giving you some of the citations here. This one I think is particularly interesting. A recent cross-sectional study included male and female participants post-concussion as well as control participants. And what it showed was that cervical spine proprioception impairments may persist for as long as 3 years following concussion. I said this in the introduction, but proprioception, what is it? It is internal body sense, so that when you close your eyes, your brain knows where your body is in open space, even if you are not moving. This is what is essential so that we can actually stand upright as human beings. And the neck in particular, because it's what supports the head, there are a huge volume of these proprioceptors, which are always sending signals so that we can be upright like this. The problem then is if a person has impaired proprioception, number one, kind of at the bad end of things, it can make a person feel really, really dizzy, what's called a cervicogenic dizziness. But even on the low grade side of things here, it's also sending a lot of information about what the muscles are doing and what the position of joints in the spine are actually doing at any given moment. So we know that principle, or hopefully you've heard of it. Garbage in, garbage out. So if there is ever an issue with proprioception and your brain is receiving crappy information, it can affect the quality of the motor signals that are going back down. The consequence of that is you can start to have abnormal or asymmetrical changes in muscle tone tension. That can then set us up for future injury. Sometimes the neck, yes, but it can also extend all the way down to the low back and even to the knee, the hip, and the foot. Because when you're standing, that system needs to be working in full balance so that we can stand upright and move around and do whatever we need to do in proper sport. So if you impair proprioception, simply put, I'm saying that this sets you up for the potential for future injury. But what they said here is that you can have impaired proprioception for up to 3 years following a concussion. So there's your citation right there, Smulligan, 2024. And oftentimes this can be a big problem. We gauge our well-being as a culture based on how we feel. Proprioception, unless it's making us feel dizzy, is not something that we feel. It's not something that's producing pain. So there can still be a problem even though we don't actually feel it. Another study, which examined male participants with a history of concussion up to 1 year, so they were only checking people with a concussion 1 year after, and control participants showed that the group with a history of concussion had substantially worse joint position error. This goes back then to that very first point that I had mentioned, that when we think of head injury, so many of the different tests and the on-field trainers, physical therapists have gotten so much better at this over the years to know we shouldn't just be assessing function of the brain, we also need to be assessing function of the neck. Because what this particular study, Kinney in 2024 is describing is that you injure the head, you also end up injuring the neck. So any assessment needs to include not just the head, but also the neck. So they ultimately say what we've already said. These findings suggest that baseline testing of factors such as manual examination of the cervical spine, not just, oh, okay, let's do a light little tap like this, looking for broken bones or bleeding or anything like that, but actually seeing a qualified professional, chiropractor, physical therapist, to simply assess on an individual basis, is the cervical spine moving and functioning the way that it is supposed to? Because when it is, we expect good quality information going up. But if it is not moving the right way, then what it can do is, again, it's sending abnormal signals up to the brain that can set us up for future injury. So it should include that, and it should also include this joint position error sense. And I've talked about this on a lot of other videos, a lot of ways of doing it. Simplest one, you have a bullseye on the wall, you have laser glasses right here, you move your head and then you bring it back to whatever you feel is the center. If you're consistently hitting the middle of the bullseye, you're fine. But if, for example, put your head down and then it comes back like this, where you can see it'd be crooked shooting off to the side, it's sending crappy information up to your brain. So this is what they are saying, that this is going to be super important. So in this study, what they did, they looked at 94 elite and pre-elite athletes, 14 to 34 years old, from the Queensland Academy of Sport, and they put them into two groups. So they were looking at those who have a history of concussion, those who do not. And they were assessing then, number one, manual assessment of the neck. Are things moving the right way? Yes or no? They had them do this joint position error testing that I just described. And what they also had them do is they had them do what's called Vestibulo-Ocular Screening. And there's a series of this. And again, this might be more of interest for those who are in academia or a clinical practice here. But these are the screening tests that they did. So number one, what's called smooth pursuits. That, simply put, is slowly moving something in front of your eyes like this. And are your eyes able to track it smoothly side to side, up and down like this? This is assessing essentially brainstem function, and also cerebellum. There's a lot more neurology involved, and there's a lot of other higher centers that are involved there, but that's kind of the short of it take home, that your brain is not cheating like with the eyes skipping in different ways. That's what's called a saccade. So they also checked horizontal, vertical saccades. So can your eyes actually move and focus on something quickly, going side to side, up to down? So that's going to be a slightly higher center of brainstem, so the midbrain, and also the cortex, this area right up through here. Near point convergence, so your ability to maintain focus on an object as it's coming closer toward you. Horizontal and vertical vestibulo-ocular reflexes. So this is where you're going to be trying to maintain stability, focus or something as you're moving your head like this. And if you have a moving object, can you actually track it going in different directions? And lastly, visual motion sensitivity. In other words, if you've got stuff that's moving around you, you start feeling your eyes going super dizzy. So they were looking for these different kinds of things. And as I'm going to scroll down here just a little bit more here. So where are we going? What we're going here? Okay. So they're looking at these two groups, and what do they find? No significant difference between groups. Variables measure symptom evaluation. So symptoms, whether you did have a concussion or not, didn't really seem to matter. Cognitive screening, coordination, and balance errors, they seem to be pretty good. I do believe that they said that there was a bit of a difference between groups when they were doing a balance assessment. And this is a very simple at-home test that you can actually do. Simply put, bring your feet together. There are ways that you can challenge it, making it a little bit more dynamic, such as standing on one leg only, standing on a pillow, doing it with your eyes closed, different kinds of things like that. But point being is if you stand with your eyes closed straight like this, you should be able to maintain upright stability. But if you find like you're losing your balance and whoa, that's really, really hard, that's a sign of abnormal proprioception. Something ain't working right between coordination with your body and the rest of your brain. So they do find that there's a difference between people who have had a concussion in the past versus those who haven't, again, irrespective of any symptoms that they might be experiencing. Now, one thing that they did find is that if people could elicit or they had a history of headaches, that was more closely correlated with when they had that past history of the concussion. And vast majority of headaches, it's not because something weird is growing on the inside of the brain. It's because of transmission error from the nerves in the neck, which are supplying the sensory areas on the back of the head and the neck. But the other things that they find abnormal muscle tone and movement in the neck, and also these abnormal joint position error tests, and also this abnormal vestibulo-ocular reflex tests. In a few of my other videos, I've kind of showcased how if a person's ever doing vestibular rehabilitation, you've actually got to have the foundation. The neck has to be sending the right information up into the brain. Because then, if and when you start to do so many other vestibular retraining exercises, they're not able to do it on a firm foundation. You're getting garbage information from the neck. Then the head has absolutely no idea where it is, so then it's impossible to re-coordinate movements between the eyes and between the inner ear in the right way. So that basically kind of highlights all of the findings from this study. Again, it was really well done, really good information right here, but also, again, wanted to give you guys a few more of the additional citations right here as well. So what we'll do is we'll wrap, and I'll hit that take-home message one more time here for you, and then give you a few more resources about how and where you can follow up with this stuff. So back to the beginning. Head injury equals neck injury. Persistent issues associated with concussion, they can last for 3 years following the injury, and that is even if you are feeling completely okay. Therefore, very important that whether you are going into sports for the season, or especially if you have experienced some type of head or neck injury, you're not simply basing things in terms of, yep, I'm fine, all good, because you don't have pain. Very wise that you check the balance system of the body. Important that you assess the balance systems of the neck. Important that you assess, is the neck moving the right way in the first place? And last but certainly not least, check the coordination between the inner ear and the eyes in being able to maintain overall focus. Fortunately, every single one of those, even if you do find an abnormal something going on, every single one of those can be improved on, just in the same way that you would go to the gym to exercise muscles to make them stronger. There are certain procedures and there are also exercises that can be done to help to rehabilitate the neck and also the brain, because as I've said, not only, especially if it's a concussion, do you need to make sure that those neural pathways are communicating the right way, but you need to make sure that the body as a whole is healing up the right way so that it does not leave you susceptible to future aggravation down the track. So a little bit of a technical video there, but hope you guys did enjoy it. If you did, please again, make sure that you click the like, subscribe button. That way this information can go out to other people who are going to find it valuable. Please feel free to share this with friends, family members, colleagues, people you think would benefit from learning this kind of information. And if you want more info in terms of what you can be done, or what can be done, what you can do, check out some of the other videos that I have on this channel. And you can also go over to our clinic website, Clear Chiro Spokane, where we've got all kinds of blog articles, videos, things like that that let you know what can you do to help restore health of your neck, health of your brain, ultimately quality of life. Thanks again for watching. This is Dr. Jeffrey Hanna at Clear Chiropractic. Get well, live well, stay well.